Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Malavrot in last 2-3 episodes. I have given much more time for this topic because of two reasons. First reason, the complaint is very commonly seen in our practice, and secondly, the focus to completely cure it is very rare, and many a times a patient and also doctor thinks of a symptom treatment means take these tablets for 2-3 days and you will get be okay. There will be good system availability and you will be fine. But again, the frequent complaint is seen in the patient. Hence, to cure this problem completely, as we have discussed previously, Hetu Parivarjan is very important. Yogya Ahar Vihar is important, and according to the history or intensity of the constipation, Anuloman, Sramsan, Bhedan, Virechan are to be chosen. In today's lecture, I will put in front of you what is my aspect when the patient with Malavrot complaint occurring frequently comes in my clinic. Now, Hetu Parivarjan is common to all, so dry food is avoided, drink lot of water, good exercise, late night sleeping should be avoided, you all know that. When choosing a laxative or a dravya for Sushtamala Pravritti, you have many options as we have discussed, Anuloman, Sramsan, Bhedan, Virechan, many dravyas like Haritaki, Nishottar, Sonamukhi, etc. You also know that. My approach is that, for example, Haritaki is Dravya, or Triphala Churna is used for the Sushtam Pravritti, Nishottar is used, Sonamukhi is used. All these Dravya are very good for Sushtam Pravritti, but what is their action by their Virya or by their Prabhav? They throw out the Sanchita Malava outside the body. Patient feels better. Okay, I am very evacuated completely and I am feeling really better. There is no irritation throughout the day. But whether root cause of the constipation, which is mainly dryness of the intestines, is cured or is taken care of by these dravya, I think I am doubtful about this. Unless and until the main reason that good movement of bowel is not you are getting to reach by that to that goal, you will not find the Malavrot to be cured completely. By these dravya which are forcefully throwing out the Malava, Sushta Malavrutti will be seen in the patient, but it will not eradicate the root cause. Hence, when a patient comes to me, I always think of the Snigdha Gunatmak Sushtamula Pravritti Dravyas. Even I start even with the say plain milk and ghee, manukke or black grapes, aragvat, isabgol, like that, depending upon the intensity of constipation, kostha of the patient. My favorite dravya for this aim is erendatil, castor oil, which is have a high intensity of Sushtamala Pravritti and it is also a Snigdha Gunatmak dravya. So all these dravya along with the Sushtamala Pravritti, they perform the action of lubrication to the intestines. What will happen by this? As the intestines get lubricated, the dependency on the medicine will be reduced and patient will have malapravritti or Sushta malapravritti by its natural way. Of course, this doesn't happen in 1 or 2 days. You have to ask or convince the patient or counsel the patient that if you want to get cured completely by this problem, you have to take these dravyas for a longer time. You can start if you want to give castor oil and if you are really getting confusion whether it will be a strong purgative for that person or not, to give or not. In my practice, I start with a 1 spoon or even a half teaspoon daily and increase the dose day by day depending upon its effect. When you are giving this in small dose, it will not have a strong action and there will no like diarrhea or malavek will be in control. The small dose will be increasing dose, right, from the small to higher dose. It will lubricate the intestines along the in future with a certain course of time, and then patient will have a natural Sushta Mala Pravrutti. Hence, in my practice, I generally use the Snigdha Dravyas with Sushta Mala Pravrutti, and I use them in a increasing dose. If the koshta is mrudu, there is very less chances of malavrut, but still, if in madhyam and mrudu, even we can start with the aragvar, but generally, patient having complaint, they require a strong gudatma dravya like castor oil. But it is your choice to give aragvar, isagol, dugdagruta or castor oil. It is your choice. So, to eradicate the malavrut complaint completely, in my practice I always use Snigdha Viration starting from Alpamatra and increasing day by day, and for this you have to give time to the patient to counsel and convince that you are going this by this way, and it will take time but it will give a permanent results. In case of senior citizens, there is a natural constipation because of Vatajakal, and there is natural dryness. What happens in that case? The patient always feels there are stones of Malabha. So for stones, Pindita Mala, Bhidar is indicated in the Grantha. Okay? But this problem is only in the last part of the anal canal, or say you can say rectum. If you give Bhedan in the senior citizens, just because of there is Pindita Mala, it will irritate all the GI system and then throw the Malabha out of the body, which will make the person weak, and again the main reason dryness will not be cured. So even in such patients with Jeshta or senior citizens with dryness and very common complaint of high irritation because of constipation, I suggest Tilatela enema, Matra Basti, and because that last part of the anal canal and rectum are to be lubricated only, other system does not require much more oiling in that particular age, and patient always says to you that I have to finger it out, and when the after fingering the stones are removed and of mala are removed and I will feel better. It means the problem is at the last part, and so you don't need to irritate all the GI system by Vedan or Virishan Dravya in old ages. Even Snigdha Guणात्मक Dravya like glycerin suppository are also advisable in this patient because it is harmless, it is of Snigdha Guna, and it will not irritate all the bowel of the person in that age. So, this is my point of view treating this patient to cure completely, that I use Snigdha Vireshan Dravyas for longer time, starting with the Alpha Matra and increasing the dose, or you can say Vardhaman dose, whatever you say. I will like your opinion also on this complaint and your views in your practice. Thank you very much.